Phlebotomy Exam Explained. Question 1. The most common complication of venipuncture is Option F. Infection, Option B. Anemia, Option C. Hematoma, Option D. Syncope. The correct answer is Option C. Hematoma. Hematoma formation, caused by blood leaking into surrounding tissue, is the most frequent complication of venipuncture. It typically results from improper needle placement, premature needle withdrawal, or insufficient post-draw pressure. Question 2. Which of the following terms refers to the study of blood? Option A. Hematology, Option B. Microbiology, Option C. Immunology, Option D. Radiology. The correct answer is Option A. Hematology. Hematology is the branch of medicine and laboratory science dedicated to the study of blood, blood-forming tissues, and blood disorders. Microbiology pertains to microorganisms, while immunology focuses on the immune system. Question 3. For proper specimen identification, labels should include Option A. Patient name, ID number, date/time. Option B. Only patient name. Option C. Only date. Option D. Only test type. The correct answer is Option A. Patient name, ID number, date/time. Complete specimen labeling requires at minimum the patient's full name, unique identifier, medical record number or DOB, date and time of collection, and collector initials. Incomplete labeling is a critical error that can result in specimen rejection or patient misidentification. Question 4. The antiseptic used for blood culture site preparation is Option A. Alcohol only, Option B. Iodine or chlorhexidine, Option C. Saline, Option D. Hydrogen peroxide. The correct answer is Option B. Iodine or chlorhexidine. Blood culture collection requires rigorous antiseptic preparation using povidone iodine or chlorhexidine gluconate to minimize contamination risk. Alcohol alone is insufficient for blood cultures due to its limited activity against skin flora in deeper layers. Question 5. The phlebotomist should collect a specimen for glucose analysis. Option A. After eating. Option B. With no fasting. Option C. According to physician order. Option D. Always in the evening. The correct answer is Option C. According to physician order. Glucose specimen collection should always follow the physician's order, which may specify fasting, random, 2-hour postprandial, or timed draws. No blanket rule applies. Collecting without following the order can lead to clinically misleading results. Question 6. Which of the following stops blood clotting by inhibiting thrombin? Option A. Boxalate. Option B. DDTA. Option C. heparin. Option D. Citrate. The correct answer is Option C. Heparin. Heparin inhibits coagulation by potentiating antithrombin 3, which inactivates thrombin and factors A. This distinguishes it from EDTA and citrate, which both work by chelating calcium, and from oxalate, which also chelates calcium but is rarely used in modern practice. Question 7. What is a common symptom of phlebotomy-related vasovagal reaction? Option A. Hypertension. Option B. Dizziness and fainting. Option C. Fever. Option D. Edema. The correct answer is Option B. Dizziness and fainting. Vasovagal syncope presents with dizziness, lightheadedness, pallor, diaphoresis, and fainting due to a sudden drop in blood pressure and heart rate triggered by anxiety or the sight of blood. Hypertension and fever are not vasovagal symptoms. Question 8. The term phlebotomy literally means Option A. Vein incision. Option B. Artery puncture. Option C. Skin puncture. Option D. Blood transfusion. The correct answer is Option A. Vein incision. Phlebotomy derives from the Greek phlebo, vein, and tomi, incision or cutting, literally meaning the incision of a vein. While modern phlebotomy uses needles rather than actual incision, the term remains the standard descriptor for blood collection procedures. Question 9. What color tube is commonly used for coagulation studies such as patient/INR? Option A. Green. Option B. Lavender. Option C. Light blue. Option D. Red. The correct answer is Option C. Light blue. Light blue top tubes contain sodium citrate, which chelates calcium to prevent clotting and is specifically required for coagulation studies including patient/INR. The lavender tube contains EDTA and is used for hematology, not coagulation testing. Question 10. If a patient faints during venipuncture, the phlebotomist should: Option A, ignore the patient. Option B, remove needle and assist patient. Option C, continue draw. Option D, leave patient alone. The correct answer is option B, remove needle and assist patient. If syncope occurs, the needle must be immediately and safely removed to prevent injury, and the patient should be assisted into a safe recumbent position. Continuing the draw or leaving the patient unattended are serious safety violations. Question 11. Which is most important before performing venipuncture? Option A, confirm patient identity. Option B, tourniquet application. Option C, tube selection. Option D, site cleansing. The correct answer is option A, confirm patient identity. Patient identity verification using two identifiers is the single most critical safety step before any specimen collection procedure. Collecting from the wrong patient is a catastrophic error with potentially fatal consequences. All other steps follow identity confirmation. Question 12. Which tube is used for chemistry testing? Option A, light blue. Option B, green. Option C, lavender. Option D, gray. The correct answer is option B, green. Green top tubes contain heparin, lithium or sodium, as an anticoagulant and are used for plasma chemistry testing when results are needed rapidly, as they do not require clotting time before centrifugation. Light blue is for coagulation and lavender for hematology. Question 13. Phlebotomy safety includes avoiding: Option A, hand washing. Option B, recapping needles. Option C, using sharps containers. Option D, proper PPE. The correct answer is option B, recapping needles. Recapping used needles with two hands is prohibited under OSHA's bloodborne pathogen standard because it is the leading cause of needle stick injuries. Safety-engineered devices or one-handed scoop techniques must be used if recapping is absolutely necessary. Question 14. Before performing a capillary stick, the site should be cleaned with: Option A, alcohol swab. Option B, iodine swab. Option C, saline. Option D, sterile water. The correct answer is option A, alcohol swab. A 70% isopropyl alcohol swab is the standard antiseptic for capillary puncture site preparation. The site must be allowed to air dry completely before puncture to prevent alcohol contamination, which can cause hemolysis and falsely elevated results. Question 15. If blood is drawn above and for: Option A, results may be diluted. Option B, results are more accurate. Option C, patient experiences no risk. Option D, it's preferred. The correct answer is option A, results may be diluted. Drawing above an active for site introduces for fluid into the specimen, diluting analytes and producing falsely low results. If the same arm must be used, the for should be stopped for at least 2 minutes and blood drawn below the for site after discarding the first 5 ml. Question 16. A fractured vein more likely causes: Option A, quick flow. Option B, hematoma. Option C, no blood return. Option D, arterial puncture. The correct answer is option B, hematoma. A fractured or damaged vein wall allows blood to escape into surrounding tissue, resulting in hematoma. This may also cause blood flow to slow or stop during collection. Prompt needle removal and pressure application are required. Question 17. A patient with known fainting history should be: Option A, placed in supine position. Option B, allowed to stand. Option C, told to flex arm. Option D, asked to walk around. The correct answer is option A, placed in supine position. Patients with a history of syncope should be placed supine, lying flat, before venipuncture to prevent falls and injury if vasovagal response occurs. This is a proactive safety measure that does not require waiting for symptoms to appear. Question 18. Capillary draws are preferred when? Option A, patient is dehydrated. Option B, patient is elderly only. Option C, patient is neonate or with fragile veins. Option D, coagulation studies. The correct answer is option C, patient is neonate or with fragile veins. Capillary puncture is preferred for neonates, infants, and patients with small or fragile veins where venipuncture would be traumatic or difficult. Dehydrated patients actually present more venipuncture challenges, and coagulation studies require adequate venous volumes. Question 19. How should blood from an 4 line be collected? Option A, above foresight. Option B, below foresight after turning off infusion. Option C, from same 4. Option D, ignore 4. The correct answer is option B, below foresight after turning off infusion. If no alternative site is available, blood may be collected distal to below the foresight after the infusion has been discontinued for at least 2 minutes and the first 5 ml discarded to clear for fluid contamination. Drawing from or above the foresight produces diluted, invalid results. Question 20. Which of the following can cause hemoconcentration? Option A, leaving tourniquet on too long. Option B, using large needle. Option C, proper tube mixing. Option D, site cleansing. The correct answer is option A, leaving tourniquet on too long. Prolonged tourniquet application, 60 seconds, causes venous stasis and fluid shift from plasma into tissues, concentrating blood components such as proteins, RBCs, and certain analytes, a phenomenon called hemoconcentration that falsely elevates results.